Hey everyone, welcome to the AAFE Training Center. It's Crystal and I'm here with one of my beautiful patients, and today we are doing her tox treatment. So she's actually been coming to me now for a couple of years, I think, right? Yeah. And we've kind of perfected her dose, so she tends to get the same dose every single time, same areas, and really just to kind of maintain and prevent any further wrinkling down the road. So I'm just gonna start with marking up the areas I'm treating. So raise your eyebrows for me as high as you can. Lovely. I'm gonna mark my borders, relax. And then just start dotting her up. I wanna make sure I'm treating all the way across the muscle. Angry face, beautiful. Perfect, relax. Also gonna be doing her crow's feet, big smile. Lovely, relax. And smile one more time. Perfect. And then brow lift. So close your eyes really, really tight, squeeze them shut. I want to see where the pool of that muscle is and just go right there. We are upping that dose a little bit today because she wants as much lift as possible. Also, you can tell she's got shallow eyes and a little bit of hooding. So this is going to help really open up, lift the brow, lighten that heaviness on the lid, and counteract any potential heaviness from her forehead. But obviously I'm giving a pretty low dose in her frontalis anyway. We are going to do a little bit of a lip flip. She's a little unique. I typically do all the way around, but she is used to just getting the top lip treated. So we are going to just inject her top lip. I'm not really gonna mark that up. And then we are going to do some platysma on her. So lift your head up off there for me, perfect. And then do your neck bands. So we are treating these two central bands, which when she first came to me, we were treating 4 almost across her entire neck. They were very strong. And now after multiple treatments, pretty much every 3 to 4 months, we've kind of atrophied them enough that we are only treating these 2 every time she comes back. So let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 11. I'm just going to add a little saline to my frontalis syringe so that I can evenly distribute the product. And we'll go ahead and get started. Okay, you ready?
Yeah.
Just keep breathing. So little injections. I always like to go next to my dot, never through the marker. And injecting up. She has really nice skin, so she's easy to inject on for sure. Turn towards me a little bit. All right. Okay, so frontalis is done. Now we're gonna move down to the glabella. I'm doing 5 injections on her. So I'm gonna do 1 into the center first, right into the procerus. And then both corrugators as well. Of course, everyone I film just loves to bleed. So this area, honestly, she's really not that strong in this area, but I still treat it pretty aggressively only because we know treating the depressor muscles are going to help lift and open. And that's exactly what I want for this particular patient because of her shallow set eyes and little bit of hooding she has. So as much opening of the eye I can get, the better. Turn away, you doing okay?
Yeah.
Okay. Treating crows, pulling the skin nice and tight, avoiding any kind of little vessels that I see just to limit bruising. And always injecting up and away from the eye. Turn towards me. Same thing on the other side. So I'm always pretty much parallel with the zygoma. You never want to inject down this way to limit hitting the zygomatic major, which would affect her smile, and we don't want to do that. Okay, next brow lift. So look straight ahead for me. I'm just going to confirm one more time my placement. So squeeze your eyes really, really tight. lovely, relax, pinchy. I think that injection is not fun at all. And you can see how superficial I am, that it's actually like pretty hard for me to push the syringe and I'm leaving that little white bleb. Our frontalis muscle is underneath this muscle that I'm treating. You okay? Okay.
Yeah, just.
So I want to make sure. Perfect, that I'm staying superficial. Okay, so now we're gonna move down to her platysma. So I just mark them out what I see. I'm actually gonna be giving like 1 unit per dot. On some patients, this may be a little much. It just kind of depends, but I know this is what I've done for her in the past and it's worked. So that's kind of what I do every single time. But some patients that have really petite, I mean, she obviously has a really petite body frame, but really petite body frame and not very strong platysma bands, you probably want to start at a lower dose just to make sure that they can tolerate it okay. And I'm just picking up and isolating that muscle and going straight into it. And the depth of my needle just kind of depends on the thickness of the muscle. You did great. Okay, let me just clean this. So I always just kind of wipe within the band itself and not using too much pressure. And then I saved the best for last, which is gonna be a little lip flip. I actually only do 4 injections on her, so she's just a unique case, I'll say, in terms of her lip flip. But it works for her, so that's all I care about. Pinch. And she's a tough cookie. I didn't numb her or anything first, so hence the little flinches. It's okay. This is real life, right? Everyone that we film, everyone's always like, why are the patients so good? No one flinches. And I'm like, I promise people do. I think they just let the camera get to them and they don't move. This is real life, y'all. Okay, we're all done. So now that she's done, next 4 hours, no touching, no raising your body temperature. So nothing that's gonna make you sweat, like exercise, being out in the sun, things like that. And then I already cleaned her off up here, but just always making sure we're wiping away from the eye and then just within this area. And that is it. We'll give it 2 weeks to see how her results end up. As I said, I've treated her multiple times, so we pretty much know this is gonna work for her because it has in the past. And I will see her again in like 3 to 4 months. Thanks for watching.